Hi, my name is Navid Askari. I'm an associate professor at the Strategy and Statistics area of the Gabelli School of Business and associate director of the Global Healthcare Innovation Management Center. My research examines the interplay of interorganizational and intra-organizational relationships and how they affect firms' response to technological change, mainly in the context of the global biopharmaceutical industry. In many high-tech industries, firms often collaborate with several alliance partners and maintain a portfolio of alliances that have collective properties and offer a competitive advantage. In these industries, managers also frequently undertake mergers and acquisitions to obtain access to various resources of their targets, including targets' alliances. Target firms' alliances are valuable because they offer them access to valuable technological and financial resources. Therefore, we refer to alliances as relational assets. They're real assets, they're valuable. However, what the acquirer may overlook is that the acquisitions can destabilize alliance relationships. In a recent paper, my co-authors and I investigated this issue using a novel and large sample from the global biopharmaceutical industry. This is the first study to show how an acquirer firm inherits alliances from its targets and the ensuing processes following the event of an acquisition. The fundamental insight is that following an acquisition, the acquiring firm's capacity to effectively manage an alliance portfolio will be under stress once it inherits the target firm's alliances. This situation leads to premature termination of the acquirer's pre-existing alliances and the alliances that it has inherited from its target. Then we show that the target firm's alliances are more challenging to maintain when you compare them to the acquirer's pre-existing alliances. Our further examination showed that the challenges of maintaining inherited alliances become more severe when they serve as a bridge between the acquirer and firms that the acquirer had no relationship with in the past. Let me rephrase it. The inherited alliances that introduce the acquirer to novel partners that are new to the acquirer, they are costlier to maintain and they are more likely to be terminated following the acquisition. We found this interesting because the strategy scholars often emphasize the value of alliances that somehow connect a partner to novel partners in a wider industry network of relationships. In the case of inherited alliances, that is not the case. Based on our results, overall, we suggest that when evaluating acquisitions, managers should look beyond traditional measures of value of a target's relational assets and evaluate both their post-acquisition integration costs and the threats to their stability. So, biopharma firms have been relying on alliances and acquisitions for a long time to remain innovative, and we are going to see more of such vital moves in the toolbox of pharma managers. Think of the now famous alliance between Pfizer and BioNTech in Europe that led to one of the life-saving vaccines in the fight against COVID-19. You can also think of the $13 billion acquisition of the California-based company MyoKardia by Bristol Myers Squibb. So understanding the interplay of acquisitions and alliances and the challenges of maintaining alliances and managing alliances in different contexts is critical for pharmaceutical firms that are trying to remain innovative and deliver value.